designed to recognize, in 2013, and is designed to recognize an individual that uses burden of disease data or other good evidence in bold ways to make people healthier. Barbara and Dave are champions of the global burden of disease. And even taking that a step further, they're really champions of IHME. Their commitment to our organization has been an inspiration to all of us, and particularly so to me and to Chris. I could go on about what amazing people David and Barbara are, but instead, I would like you to hear from them. So please join me in welcoming the two individuals that have made tonight possible, Barbara and David.
Thank you very much. It's been a wonderful association. We've known Em and Chris now, I guess, for almost 13 years. And had an opportunity to see IHME blossom from an original idea, which, like all great ideas, was a simple idea. The idea was that better data would allow you to make more thoughtful decisions and help the world live healthier lives. It's really not a complex, like all great strategies, it's very easy to say, it's just really hard to do. And what has been so unique and so powerful over the last decade hasn't been the idea. The academic world is awash in great ideas. What has been impressive, what has been important, and what has ultimately, I think what ultimately will be most profound about the work that IHME has done has been the execution. They've done what they've said. They've enabled a wide body of people to have that better information. People are making better decisions. And the most important thing is that we do have a healthier world. And the opportunity is that much bigger as more and more people recognize the power of the data and how much it enables better decision making. Tonight, Barb and I have the privilege and the great honor to introduce our award winner tonight, Dr. John Wong. John's here with his wife, Pauline, who appears to be the smarter half of the duo, based on our limited conversation earlier. But just like in our relationship, John has somehow garnered all the credit. John started off destined for the world of snack food. It may not be obvious to you, being a distinguished doctor, policymaker, academic, health economist that he is today, but his family is all about snack food. Indeed, all of his other siblings have made successful careers in the business world. One sibling, thank God for us, and for the 100 million people in the Philippines, John chose a different path. John went to medical school, and after medical school, instead of going into a lucrative private practice, what John did is spend 7 years in the slums of Manila, working with some of the most desperate, most indigent, and most needy people. And in that, acquired a unique insight about what it really takes to deliver healthcare that matters. And one of the big insights he had as a doc is that doing this one by one, a few dozen people a day, didn't make as big a dent as he felt he could make. When there are 100 million people in the country and 25% of them, at least, weren't getting adequate care. And so what he did is he said, you know, I need to up my game. I need to get myself involved with policy making and particularly policy design. And I'll skip the interim 20 years. Just skip ahead. And where he got to was a point of view based on the data provided in the GPD study. He said, you know, we have a national healthcare system where we're not actually treating. We don't have benefit packages for the most important things that ail us. We're treating warts, not diabetes. Not that you shouldn't get your warts fixed. But the point being that the country was not spending its valuable resources in a way that helped the most people in the most efficient and most expeditious way. What he was able to do, using this data, but also very thoughtful public policy to make that data and to share that data, engineer a very transparent policy process, get a wide variety of politicians, policymakers, doctors, care providers involved, was to allow people to see what worked best. Not because somebody was lobbying for that, not because somebody was paying for that, not because somebody went to school with the Minister of Health, but because it was the best thing to do for the people in that country. And so it is incredibly powerful. They don't call it one care, but maybe they should. But designed a whole new way for the health insurance in the Philippines to work more effectively for the people of the Philippines. And as powerful, as important as that is, it's maybe more important for the world at large to see the example that you've set, because there are many more places, many more countries, and billions more people who will benefit from the example that you have set. And for that, I want to say thank you very, very much. Congratulations.
The Philippines is undergoing a technological transition. So we're facing a double burden disease. We're still battling the communicable diseases, maternal and nutritional disorders that we had before. At the same time, the country is also experiencing high prevalences of the non-communicable diseases, diabetes, hypertension, stroke. Universal means everyone should be covered. Health implies the whole spectrum of care, from promotive to preventive to curative to rehabilitative. And coverage doesn't only mean financial risk protection, but also accessibility to services.
A person who is sick should not get poor because of illness. It could eat up their daily budget for meals and miss work because they have to pay out of pocket.
If money was cut for me or my husband, it's hard for us to provide because he's only a tricycle cab driver, so we really cannot afford doctors. Even food is very hard for us to provide and make enough money. In the end, we still need our parents' help financially.
Previously, the way benefit packages have been developed in PhilHealth is sometimes they call it decibels. Whoever shouts the loudest getting from PhilHealth, and nominations for benefit packages came from different sources.
We were having difficulty showing to the National Financing Corporation that this is a package worth investing in.
We look at the data from the GBD study. For PhilHealth, with this tool, now when some stakeholders come approach them to have them develop a package for this disorder or this service or that service, they can always point to burden of disease data and say that this service is for this particular disease and the burden is this small or this large. So they have a way of providing a rationale for either developing a package or not developing a package.
Because of what the government is seeing, and because when we present them, these are the number of children who will benefit from this, their minds are open and they most welcome the progress or the challenges that are faced them, and they're willing to help.
It took the global burden of disease estimates to help us show PhilHealth and the Ministry of Health that the burden of prematurity was real and that they weren't all dying, but the survivors were contributing to societal burdens as well. We had to try to convince them that this was worth investing. That particular day, we present our case to the PhilHealth Executive Committee, and we were there with the team that developed the Children with Disability package and all the other package developers that benefited from the global burden of disease. And as all of us came out of the room with smiles from here to here, it's like we graduated from med school again. Up to now, it makes me teary-eyed.
The benefits of the GHPP would be to reduce the risk that a family would be driven into poverty because of healthcare expenses. When I teach undergraduate students or medical students, I always tell them that medicine is not the only pathway towards helping people or improving health or improving lives. Since I've been working in epidemiology, I've begun to realize that it's very true. But one school of public health had used as a slogan that public health is saving lives millions at a time.
He is a person that you will not see as if he is somebody. No? He goes to the level of people where they are. Such that the patients are also very free with him. Even our health workers, they relate with him as peers, no? As a companion. No?
The world can look at what the Philippines has done as a good example because it has used burden of disease data to help it set priorities and lead to more efficient use of its resources.